Tajah and I'll be today's nurse for today's patient. Hi, how are you? My name is Tajah. I'll be your nurse for today. How are you feeling today?
I'm doing pretty good besides, what I'm here for.
Okay, can you confirm your name and date of birth for me?
My name is Taylor King. Date of birth is 7/30/05.
All right. What brings you in today?
Apparently, I got the dancing disease, they say. I thought I was just clumsy and forgetful, but nope, my brain is going out here doing the electric slide without telling me. It's called Huntington's disease. Sounds fancy, huh?
Yeah, sounds familiar. The Huntington disease is a rare inherited neurodegenerative disorder. It causes progressive breakdown of nerve cells in your brain, affecting movement, mood, and memory over time.
So basically, I'm turning into a confused breakdancer with an attitude problem.
If you say so at the moment, but we're going to do further diagnosis to see what's really going on and get the accurate diagnosis, okay?
Okay.
Okay, let's start. To further educate you, Huntington is an autosomal dominant disorder, meaning only one faulty copy of the gene is needed to cause the disease. It's caused by a CAG trinucleotide repeat expansion on chromosome 4. The more you repeat, the earlier and more severe the symptoms are.
So, what is a CAG?
A trinucleotide?
Yes.
It's the defective gene codes for a toxic protein, which is the Huntington, which leads to neuronal death, especially in the basal ganglion and cerebral cortex.
So basically, all of this is going on in my brain, which causes me to act out.
Yes, in your DNA, your motor neutron.
Okay. If one parent has the gene, what's the chance their child gets it?
50% chance it's an autosomal dominant.
Hello Taylor, my name is Dr. Sherman, and today I wanted to do some physical assessments of you because unfortunately you do have Huntington's disease.
Who said I had that?
The MRI.
Your nurse had talked to you a few times, and unfortunately I wanted to do a few physical assessments, so could you please stand up and try to walk in the straight line, please?
And I'll be here for your assistance.
This makes me mad.
Okay, that's enough, sweetie. You can sit down.
Don't understand why this happened to me.
Symptoms develop gradually and worsen over time. They are usually categorized into 3 stages. Early stage, mood changes, depression, small movement issues, and forgetfulness. Then you have the middle stage, involuntary movements, which is chorea, balance issues, personality changes, and cognitive decline. Then you have the late stage, severe dementia, difficulty swallowing, total dependence. And as from the looks of it, I can see that you're in the early stage, Taylor.
So when I started dropping cereal boxes and forgetting names, that was just the intro? What's usually the first signs a family notice?
Changes in mood or behavior, like depression, anger, or withdrawal. Genetic testing confirms that the diagnosis by counting the CAG repeats. Brain imaging like MRI or CT may show atrophy in certain areas. Neurological exams help assess motor, cognitive, and psychiatric symptoms. Genetic counseling is offered to help families and understand the risk.
So my DNA snitched for me? Y'all ever seen a gene that petty?
Complications include falls, malnutrition, aspiration pneumonia, and eventually death.
Death? So you're telling me I'm going to die from this? I'm so young.
Most people live 10 to 30 years after diagnosis. There's a high rate of depression and suicide due to the disease progressive nature. But listen, Taylor, us doctors around here are going to take good care of you.
This is a lot to take in. But I guess you could say knowledge is power, right?
Yeah. There's no cure, but symptoms can be managed. I promise you that. Tetrabenazine reduces chorea. Antidepressants and antipsychotic help with mood and behavioral issues. Multidisciplinary therapy, physical, occupational, and speech is essential for independence.
So you can't stop the train, but you can slow it down, basically. So you're telling me these actions and these care plans are going to make up for you when you delay it, I guess?
It will help. It is manageable, and we're going to help you as best as we can. So I'm going to lead in your third
Second nurse
your second
report.
document.
So let's start with Taylor's DNA, the body's instruction book. There's one little part of that book, the Huntington's gene, that's supposed to say something like CAG, CAG, CAG a few times, kind of like saying hello 3 times. But in Taylor's book, that part says CAG way too many times, like 40 or more. That's a problem because when your body sees too many of these repeats, it starts making the wrong kind of protein that can hurt your brain. This image shows a triple repeat expansion, specifically CAG in the HTT gene. A normal ally contains 10 to 26 CAG repeats. Taylor's genetic test revealed over 40 repeats, which puts her in the full penetrance category. That means Huntington's disease is certain to develop, often with early adult onset. This expanded repeat causes misfolding of the Huntington protein, which is toxic to neurons, especially in the basal ganglia. Here we use a Western blot, a laboratory technique. This next test is like checking how much of a certain ingredient is in a recipe. In this case, we're checking how much of a protein called Huntington is in Taylor's blood. People without Huntington's have just the right amount, but Taylor's tests show dark bands. That means there's too much of the wrong kind. Her body is making a faulty version of this protein, which builds up and starts messing with her brain. This is a Western blot using the MAB2166 antibody. Taylor's lane shows abnormality, dense bands at high molecular weights, indicating aggregation of the mutant Huntington protein. This correlates with protein misfolding and neuronal toxicity. The polyglutamine expansion leads to inclusion bodies that disrupt normal cellular functions, particularly in the chiastic nucleus and putamen. This colorful brain picture shows how active different parts of Taylor's brain are. The bright reds and yellows are areas working really hard and sometimes too hard. That's because her brain is trying to fight back against the damage happening from the bad protein. So even if Taylor doesn't feel really sick yet, her brain is already changing behind the scenes. Here we're reviewing Taylor's fMRI scan showing hyperactivation in subcortical and frontal lobe areas. This is consistent with early Huntington's disease, where compensatory overactivation occurs before noticeable atrophy. Red/yellow areas signify increased blood flow linked to neuronal stress and cortical excitotoxicity, often preceding motor and cognitive decline. This one simple. Look at two brain pictures. One is a normal brain, the other is someone with Huntington's. You can see big empty spaces in Huntington's brain. Those are spots where the brain cells have died or shrunk. Taylor's MRI looks more like the one with the spaces, which tells us the disease is already starting to damage parts of her brain. These side by side MRIs show classic Huntington's neurodegeneration, especially in caudate and putamen. Taylor's scans exhibits ventriculomegaly and cortical thinning. These correlate with loss of GAB ergic neurons, contributing to chorea and executive dysfunction. It also aligns with stage 1 progression based on brain volume assessments. These are a bunch of pictures of Taylor's brain, like slices from a loaf of bread. They help us see different areas more clearly. We use these to track how much damage is happening over time. That way, we know if the disease is getting worse or staying the same, and we can adjust our care plan. This chart is super helpful. It shows how many CAG repeats someone has and what that means. Taylor is in the pink section with 40 or more repeats. That means she will get Huntington's disease. It doesn't mean she's sick right now, but it tells us that her body is already starting to process. This chart categorizes CAG repeats lengths into normal 10 to 26, intermediate 27 to 35, reduced penetrance 36 to 39, and full penetrance 40 plus. Taylor's results place her in the full penetrance category with high risk of early onset disease. This classification is critical for genetic counseling, especially for future reproductive decisions and familial risk assessment. So to wrap things up, Taylor's test results clearly confirm early Huntington's disease. While that news is difficult, it gives us the power to plan, treat, and support her before things get worse. Early interventions like medication, physical therapy, and mental health support can help maintain quality of life. Understanding the science behind her diagnosis also helps us provide better care and compassion for patients like Taylor. Thank you.
Hi, I'm your night shift nurse Smith. I spoke to the day nurse earlier, and our focus plans include fall prevention, safety equipment, assessive devices, nutritional support, swallowing assessments, supplements and mental care, supportive groups and referrals, advanced planning, end of care, support groups, and family education.
What's a priority nurse diagnosis for me?
Risk of injury related to involuntary movements and impaired coordination.
I guess you could just put that on the chart. And don't forget to raise those big rails. I already tried to 2 steps and nearly broke a hip.
I'm so sorry. This disease affects the whole person, the mind, the body, and the spirit. Patients need support and dignity.
And nurses will keep it real. That helps too. Thanks for all.
Huntington is a progressive inherited brain disorder. It impacts movement, mood, and memory. There is no cure, but a treatment can manage symptoms. We as nurses play a key role in education, safety, and emotional care. We're here to support our patients who experience this disease, and just know that we are protecting them.
Experiencing any of these symptoms? Don't wait. Come to Copper University Hospital, where the top nurses don't just treat you, they educate you, support, and help keep you dancing. Even if the dance is you didn't dance for.